Once screening has been completed, the next step is to manage outcomes. The patient may pass all components, fail vision or strength testing, fail cognitive testing, or have a lapse of consciousness diagnosis, or receive an incomplete if they are unable to complete or refuse to take all tests. Many of your patients may pass the screening, but still have medical conditions like diabetes that could affect driving. You'll also want to watch for drug interactions and medication errors. If the patient fails vision or strength, or has a medical condition other than one characterized by a lapse of consciousness, begin by confirming the diagnosis, but no driving until the workup is complete. If the diagnosis is confirmed, ask if the patient wants to continue driving. If not, have them formally surrender their license. Document this and discuss alternative transportation. If they want to continue driving, treat any manageable or reversible disease and reassess. If the patient fails the cognitive tests or has lapses of consciousness, you must report them to the Department of Public Health and continue to work them up as appropriate. With either outcome, further evaluation may be appropriate. There are two types of professionals that can help. One is the occupational therapist generalist, and the other is the driver rehabilitation specialist, or the DRS, who is frequently an occupational therapist with advanced training and certification. The OT generalist has experience and knowledge in cognitive and physical dysfunction, patient psychosocial issues, and instrumental activities of daily living. They can assess subskills related to driving, although they do not evaluate driving competency itself. The driver rehabilitation specialist performs the comprehensive driver evaluation, both clinically and on the road. They can provide therapy to strengthen areas of impairment. They can also establish protocols to determine competency for the use of adaptive equipment and counsel for driving cessation and alternative transportation. Barriers to obtaining DRS services can include cost factors and lack of program availability. In most cases, this service is not covered by insurance. If you are recommending driving retirement, involve the patient in the decision-making process and encourage questions. After finishing this tutorial, you can find a video demonstration of a counseling session on the TREDS website under Health Professionals. Whenever possible, work with family and friends for support and transportation options. Provide referrals to community resources. It can be a difficult topic to address, as patients may be in denial and fear losing their driving privilege. Acknowledge that the patient has suffered a loss and look for signs of depression. Remind them that driving retirement is for their safety and the safety of others. Point out possible legal consequences that could result from an at-fault crash. You could even remind them of the benefits to not driving, like avoiding insurance and registration fees, and the cost of gas. As always, be sure to document your recommendation in a letter to the patient. In summary, when patients fail one or more tests, additional follow-up or referral to a specialist, an occupational therapist, or a driving rehabilitation specialist may be indicated. It is helpful to be familiar with alternative transportation options, things like rides with friends, family, or volunteers, ride-sharing services, senior shuttles, or the bus, even walking. The Department of Aging office in your county may be a helpful resource.